Have you ever wondered if your daily hygiene habits might be revealing more about your health than you realize? For many older adults, small oversights in personal care, things like brushing habits, bathing routines, or how often they check their skin or nails, might actually be silent signals of deeper health concerns. What's shocking is that doctors are trained to notice these things instantly. In fact, in many cases, they can detect early warning signs of serious medical conditions just by observing these seemingly normal hygiene patterns. Many seniors take pride in being independent and assume they're managing just fine when it comes to cleanliness and self-care. But what they often don't know is that small hygiene mistakes can sometimes be early indicators of heart issues, cognitive decline, diabetes, or even internal infections. These signs often go unnoticed at home, but to a trained physician, they can speak volumes. Let me share something that might surprise you. Most of what we're taught about hygiene, especially as we age, is outdated or incomplete. These are not things you'll learn from typical health pamphlets or routine checkups. But understanding them could mean the difference between catching a serious illness early or facing life-altering complications too late. That's why today, I want to walk you through 7 overlooked hygiene mistakes that many seniors make every day, and more importantly, what you can do right now to fix them. To illustrate just how critical these issues are, let me tell you about Margaret, a 72-year-old retired school principal. Margaret considered herself a healthy, active senior. She walked daily, ate well, and was always impeccably dressed. But during a routine doctor's visit, a few small signs caught her physician's eye: slightly swollen gums, dry patches on her legs, and brittle fingernails. Nothing that seemed urgent to Margaret, but her doctor saw red flags. After a few tests, Margaret was diagnosed with early-stage heart disease and a mild vitamin deficiency, issues that could have gone undetected for months had those tiny hygiene cues not been recognized. Stories like Margaret's are not uncommon. That's why what I'm about to share with you is so important. These hygiene habits may seem harmless, or simply part of getting older, but they're often the first signs your body is sending out when something deeper is wrong. And the good news? Every one of these mistakes is easily fixable. No expensive treatments or complicated routines required. So if you or someone you love is over 60, pay close attention to what comes next. Because these small changes in daily hygiene routines could not only improve your quality of life, but actually save it. It's time to start seeing your hygiene habits not just as maintenance, but as a form of self-diagnosis, your body's way of quietly asking for help before things go too far. 1. The hidden danger behind your toothbrush. Why oral health matters more than you think. Most people don't realize how much their mouth reveals about their overall health until it's too late. For older adults especially, oral hygiene isn't just about keeping a bright smile. It's a silent but powerful predictor of heart health, memory, and even longevity. Yet every day, millions of seniors skip simple habits like brushing properly, flossing regularly, or going to the dentist. Not because they're careless, but because they've never been told just how critical those small actions really are. Let's face it, as we age, we tend to focus on the big health concerns: blood pressure, cholesterol, joint pain. Dental care often gets pushed to the background, especially if you're not experiencing any toothaches or visible problems. But here's the scary truth. Many life-threatening illnesses begin quietly inside the mouth. According to geriatric researchers, bacteria from untreated gum disease doesn't just stay in the gums. It slips into the bloodstream, triggering inflammation that damages blood vessels, increases the risk of stroke, and even contributes to cognitive decline. Harvard studies have shown that seniors with poor oral hygiene are significantly more likely to suffer from heart disease and dementia. It's not just about tooth loss anymore. It's about life loss. Consider the story of Margaret, a 70-year-old retired nurse who always took pride in her independence. She brushed her teeth once a day and occasionally rinsed with mouthwash, but hadn't seen a dentist in years. "I figured my teeth were fine," she said. They weren't hurting, but she started noticing shortness of breath, occasional chest tightness, and fatigue. Her doctor ran tests and discovered that Margaret had developed endocarditis, an infection of the heart's inner lining. The source? Bacteria that originated in her mouth. No one had ever told her that bleeding gums could lead to a heart condition, and by the time it was caught, she required aggressive treatment. The real tragedy? It could have been prevented with daily flossing and regular dental visits. You might be thinking, I've got dentures, so I don't need to worry. But that's a dangerous assumption. Dentures still require careful cleaning, and your gums still need professional examination. Oral infections can form even without natural teeth, especially if hygiene routines are inconsistent. So what should you be doing? Start by replacing your toothbrush every 3 months, or sooner if the bristles look worn. If possible, use an electric toothbrush, which removes more plaque and requires less pressure on fragile gums. Brush twice a day for a full 2 minutes, morning and night. Set a timer if you need to. Floss every evening. Yes, every evening. It's not optional. That's where the most dangerous bacteria hide. If your gums bleed when you brush or floss, don't assume it's normal. It's not. It's inflammation, and it could be a sign of infection. Make an appointment with a dentist, even if you feel fine. Prevention is far cheaper and far less painful than emergency care. Oral hygiene is one of the few health habits that gives immediate and long-term results. It affects how you eat, how you speak, how you smile, and yes, how long you live. So today, as you go about your routine, take a moment to look at your toothbrush. Is it old? Is your mouth healthy? When was your last dental checkup? These questions might seem small, but they could be the most important ones you ask yourself this year. Because ignoring your oral health isn't just neglect, it's risk. And that risk could cost you much more than a trip to the dentist. It could cost you your life. 2. When skipping a shower becomes a health risk. The overlooked dangers of infrequent bathing in seniors. As we grow older, certain habits naturally change. We may not go out as much. We may sweat less. The body slows down, and with it, so does our bathing routine. Many older adults reduce how often they bathe, thinking it's no big deal. In fact, for some, it's even intentional. I don't want to dry out my skin, they say. But here's the truth. Infrequent bathing can quietly hide serious health problems, and for many seniors, it already has. Your skin isn't just a surface to keep clean. It's your largest organ and your first line of defense. It tells stories, often before your blood pressure, joints, or heart do. And when you stop paying attention to it, subtle signs of illness can go unnoticed for weeks or even months. Dermatologists and geriatric doctors alike are sounding the alarm. Reduced bathing in older adults often masks symptoms of serious internal conditions, from diabetes and liver dysfunction to cardiac issues and kidney disease. Many of these illnesses first appear as unusual skin changes, discoloration, dryness, flaking, swelling, or odd sensations. Let me tell you about Clarence, a 77-year-old former postal worker who prided himself on being tough and self-reliant. In the winter months, he began bathing only once a week. I wasn't getting dirty, so what's the harm? He said. But over time, his skin developed patches of gray discoloration on his lower legs. He thought it was just dry skin. At his next doctor's appointment, his physician took one look and sent him for tests. The results? Early-stage kidney disease, caught just in time. The irregular coloring wasn't from lack of soap. It was a symptom that had been hiding in plain sight. This isn't about staying fresh for social events. It's about staying alive. So what should you do? Start with this. Bathe at least 3 times a week, even if you're mostly indoors or not physically active. Use mild, fragrance-free soap that won't strip your skin's natural oils. After bathing, moisturize while your skin is still slightly damp to lock in hydration. This simple habit helps prevent cracks, itching, and skin infections. More importantly, begin to examine your skin regularly, just like you would check your blood pressure or glucose levels. Are you noticing any unusual rashes? Flaky patches that don't go away? Itching in the same spot every day? Is one area darker, shinier, or swollen? These aren't just signs of aging. They could be early red flags of something deeper going on in your body. Also, don't forget the hard-to-see places, under the arms, behind the knees, between your toes, and the soles of your feet. Seniors are often surprised to learn that many infections, especially fungal or bacterial, start in these warm, moist environments and go unnoticed until they become dangerous. And if bathing becomes physically difficult, don't avoid it. Ask for help. Talk to a family member, caregiver, or doctor about setting up a safe routine. There are seated shower chairs, handheld sprayers, and no-rinse cleansers that can make bathing easier and safer for those with mobility concerns. Remember, clean skin isn't just about hygiene, it's about detection. It helps you and your doctor catch the early signs before bigger problems develop. In our younger years, we bathe to prepare for the day ahead. In our later years, we bathe to protect the days we still have. So if it's been a while, don't put it off. Take that shower. Check your skin. And treat it not just as a routine, but as a ritual of health, dignity, and life. 3. Nail care neglect. Most people don't think twice about their fingernails or toenails, especially as they age. A quick trim here, a little cleaning there, that's often the extent of attention they receive. But what many seniors don't realize is that nails can serve as powerful indicators of internal health issues, and neglecting them may hide warning signs of serious medical conditions. Discoloration, thickening, brittleness, or unusual ridges are often dismissed as part of getting older, yet doctors know these seemingly minor changes can point to everything from fungal infections and anemia to heart disease and thyroid problems. In fact, studies show that in people over 65, nail abnormalities have led to the early detection of systemic diseases in nearly a third of cases. Consider the story of Beatrice, an 82-year-old woman who thought her yellowing toenails were just cosmetic. She ignored them for years, wearing closed shoes to hide the appearance, until pain forced her to visit a podiatrist. What she believed was a minor issue turned out to be a persistent fungal infection, and further examination revealed a suppressed immune system and a more serious underlying condition. Her nails were trying to warn her, but like so many others, she wasn't listening. Proper nail care for older adults isn't just about grooming. It's a form of preventive health care. Regularly trimming nails straight across, keeping them clean and dry, checking for signs of infection, and wearing proper footwear can make a world of difference. It's also important to seek medical attention for any pain, discoloration, or changes in nail texture, rather than brushing them off as normal signs of aging. For seniors, small oversights can have big consequences. Ignoring nail care can lead not only to discomfort and infections, but can also allow silent health issues to go undetected for far too long. In a stage of life when maintaining independence and quality of life is so vital, paying attention to even the smallest details, like your nails, can help protect your health, your mobility, and your overall well-being. For incontinence mismanagement. For many older adults, incontinence is an uncomfortable and often embarrassing topic, one they would rather not discuss, even with their doctors. Yet it's a reality for over half of seniors, and the consequences of ignoring it can be far more damaging than the condition itself. Incontinence, whether occasional leakage or more frequent accidents, is often hidden rather than treated. Some seniors rely on makeshift solutions like folded tissues or multiple clothing changes throughout the day, hoping to quietly manage the issue on their own. Unfortunately, this silence can lead to serious health complications, including painful skin infections, dangerous falls, and even social isolation. What's more alarming is that incontinence is not just a nuisance. It can be a symptom of more serious underlying problems such as urinary tract infections, bladder dysfunction, or even prostate or kidney issues. Doctors have long warned that failing to address these concerns early can lead to avoidable medical crises. Take the story of Douglas, a 73-year-old retired accountant who thought he was handling things discreetly until recurring sores and discomfort forced him to see a doctor. What began as occasional leakage turned out to be linked to an advanced prostate condition that had gone undiagnosed for months. If he had spoken up sooner, the treatment would have been simpler and far more effective. Managing incontinence properly involves more than just staying clean. It requires accepting it as a medical issue, not a personal failure. Using absorbent products designed specifically for incontinence, establishing a regular toileting routine, keeping the skin clean and dry, and most importantly, consulting a physician at the earliest signs can drastically reduce risks and improve quality of life. There is no shame in seeking help. Health professionals see this every day and understand how to help seniors regain comfort and confidence. Aging should never mean suffering in silence. Acknowledging and treating incontinence proactively can preserve not only physical health but also dignity, social engagement, and a sense of control that every person deserves, regardless of age. 5-Ear hygiene. Ear care is often overlooked in daily hygiene routines, especially among older adults, yet the way seniors clean their ears can have serious, even permanent consequences. Many continue the habit of using cotton swabs, inserting them deep into the ear canal, believing they are doing something helpful. In reality, this common practice is one of the leading causes of ear injuries among the elderly. Doctors and ear specialists warn that improper ear cleaning can lead to wax impaction, infections, and in severe cases, even hearing loss. For some, this damage develops slowly and silently until it becomes irreversible. Patricia, A 71-year-old retired librarian had cleaned her ears the same way her whole life, using cotton swabs to dig out earwax. One day, she accidentally punctured her eardrum, resulting in a painful infection that spread and permanently impaired her hearing. No one had ever told her how dangerous her routine was. The truth is, ears are self-cleaning to a large extent, and inserting anything into the canal can disrupt that natural process. Instead, experts advise gently wiping the outer ear with a warm, damp cloth and avoiding any tool or object smaller than your elbow. If wax buildup becomes a concern, over-the-counter eardrops can soften the wax safely, and persistent discomfort should always be evaluated by a professional. Many seniors also ignore early signs of ear trouble, feelings of fullness, itchiness, discharge, or subtle changes in hearing, thinking these symptoms are just part of getting older. But often, they're early warnings of infections or conditions that need medical attention. Hearing is more than just a physical function. It plays a vital role in communication, independence, and mental well-being. Losing it due to preventable damage can have a profound emotional impact. That's why it's crucial not to dismiss ear care as a minor detail. Safe hygiene habits, regular checkups, and awareness of warning signs can protect one of our most valuable senses, ensuring that we continue to hear not only sounds, but the voices of those we love well into our later years. 6. Neglecting foot hygiene. A hidden risk that could cost you more than you think. As people age, personal hygiene often becomes more challenging, and one of the most overlooked areas is foot care. Many seniors rarely pay attention to their feet beyond putting on socks and shoes. But according to podiatrists specializing in geriatric care, neglecting foot hygiene can be one of the earliest warning signs of serious medical conditions, including diabetes, nerve damage, neuropathy, and poor circulation due to vascular disease. This isn't just about dry heels or cracked skin. Your feet can reveal critical clues about your internal health, long before you feel sick or notice symptoms elsewhere. Take the story of Raymond, a 76-year-old retired factory worker from Illinois. For years, he ignored the dry skin and minor cuts on his feet, assuming they were just normal signs of aging. "My feet had looked rough for a long time," he admitted, "but I figured it was nothing serious." It wasn't until his doctor noticed the condition of his feet during a routine checkup that further testing was ordered. The result: early-stage diabetes. Had his doctor not caught the signs in time, Raymond might have continued living with the disease undiagnosed, risking long-term complications like severe nerve damage or even limb amputation. Unfortunately, Raymond's case isn't rare. According to the American Podiatric Medical Association, up to 85% of diabetes-related amputations could be prevented through proper foot hygiene and regular foot inspections. That's a staggering number, and it highlights just how powerful a simple daily routine can be in protecting your long-term health. Seniors often experience reduced sensation in their feet as they age, which means they may not feel pain from a small cut, sore, or developing infection. Left untreated, these minor issues can escalate into major health crises. So, what does proper foot hygiene look like? First, it's essential to wash your feet daily with warm water and mild soap. Make sure to clean between the toes, where bacteria and fungi thrive. After washing, dry your feet thoroughly, especially between the toes, to prevent fungal infections like athlete's foot. Apply a moisturizer to the tops and soles of your feet to keep the skin from cracking, but never apply lotion between the toes, as excess moisture in that area can lead to infection. Inspect your feet daily for changes in color, temperature, or the appearance of sores, blisters, or cuts. Pay attention to whether any wounds seem slow to heal. This could be a warning sign of diabetes or circulatory problems. Look for signs of swelling, redness, or dark spots, which may suggest infection or tissue damage. If you notice anything unusual, don't wait to see a doctor. A quick response could prevent serious consequences. Also, choose the right footwear. Always wear clean, dry socks made of natural fibers or moisture-wicking materials, and make sure your shoes fit well and offer adequate support. Ill-fitting shoes can cause pressure points, leading to blisters or ulcers. Trim your toenails straight across to avoid ingrown nails, and never attempt to cut corns or calluses yourself. Leave that to a podiatrist. Finally, if you experience numbness, tingling, burning sensations, or persistent foot pain, don't assume it's just part of getting older. These are all red flags that your nerves or blood vessels may be affected. Seek medical attention promptly. In short, your feet may be far from your heart, but they're often the first to send distress signals about your overall health. By giving them the care and attention they deserve, you're not only maintaining good hygiene, you're potentially preventing serious health complications that could impact your mobility, independence, and even your life. 7. Overlooking medication-related hygiene changes, a silent threat to senior health. As people age, it's common for their list of daily medications to grow, managing everything from blood pressure to cholesterol, arthritis, sleep issues, and more. But what many seniors don't realize is that these very medications, while essential for treatment, can quietly trigger changes in the body's hygiene that may be signs of something far more serious. Ignoring these hygiene-related symptoms can lead to misdiagnoses, toxic reactions, and in some cases, life-threatening health events. Barbara, a 67-year-old retired nurse from Florida, experienced this firsthand. Despite bathing regularly and maintaining her usual hygiene routine, her family began to notice a strange, persistent body odor. They initially assumed she was simply not taking care of herself as well as she used to. But when Barbara finally mentioned it to her geriatrician, the doctor immediately recognized the scent as a potential indicator of medication-related liver toxicity. Further tests confirmed that her medications were slowly damaging her liver. "I had no idea the smell was coming from inside my body," Barbara said. "I thought I was doing everything right." Stories like Barbara's are more common than many people realize. According to pharmacologists at the American Geriatric Society, nearly 40% of adverse drug reactions in older adults first show up as changes in personal hygiene, like excessive sweating, dry mouth, body odor, or skin changes, before any other serious symptoms appear. These are not simply signs of aging. They are often the body's first attempts to sound the alarm that something is wrong internally. So, what should seniors and caregivers be looking for? One of the most important things is mouth dryness or xerostomia. Many medications, especially those for blood pressure, depression, or allergies, can reduce saliva production. This doesn't just make eating uncomfortable, it increases the risk of cavities, gum disease, and oral infections, which in turn can affect heart health. If you started a new medication and suddenly feel thirsty all the time, or if you're waking up with a dry, sticky mouth, don't ignore it. Another critical symptom is unexplained body odor. If you notice a new or stronger smell to your sweat, even after regular bathing, it could be a sign that your body is struggling to metabolize your medications. This is especially important if you've recently had your prescriptions changed or if you're taking multiple drugs at once. Some combinations can stress your liver or kidneys, leading to toxic buildup that manifests through your skin. Additionally, changes in sweating patterns, such as excessive night sweats or a sudden drop in perspiration, can point to serious hormonal imbalances or adverse interactions between medications. These signs are easy to miss, especially if they're attributed to menopause, hot weather, or just getting older. To protect yourself, keep a simple hygiene journal. Note any unusual body changes after starting a new medication, including how often you sweat, whether your mouth feels dry, if your skin texture changes, or if any odors become noticeable. Bring this log to your doctor appointments. It can provide valuable clues your doctor may otherwise miss. Stay well hydrated unless your doctor advises otherwise, as water helps your body process medications more effectively and can reduce symptoms like dry mouth or fatigue. But most importantly, never adjust or stop taking medications without consulting your doctor. Even if you suspect the drug is causing side effects, sudden changes can lead to severe complications. In summary, hygiene changes in older adults aren't just cosmetic or superficial. They can be silent messengers of deeper, more dangerous issues, especially when caused by medications. Paying close attention to these small but significant shifts and speaking up about them could lead to early diagnosis, timely treatment, and even save your life. In the world of senior health, no change is too small to matter. Proper personal hygiene, the key to health in old age. As we age, many of us still maintain the same body care routines as we did when we were younger. However, there are subtle changes that occur in our bodies as we age, and sometimes it is these small signs of personal hygiene that are the first warning signs of a serious health problem developing. The important lesson from this story is never ignore small changes in your personal hygiene habits. For example, bad breath, unusual sweat odor, dry mouth, or dry, dull skin. All of these can be signs that your body is having trouble adjusting to medications or even reacting to a buildup of toxins. Older people often take multiple medications every day, but not everyone knows that some medications can cause changes in body odor, dry mouth, unusual sweating, or skin changes. These changes are not simply cosmetic. They're your body's reminder that it may be time to review your medication or find out if there are any dangerous side effects. It's important to talk to your doctor if you notice a strange body odor, frequent dry mouth, unusual sweating, or sudden changes in your skin. Keeping a daily record of small changes and taking it with you to your appointments can help your doctor spot potential problems early, allowing for timely adjustments to your medication or treatment. Remember, personal hygiene is not just about cleanliness, it's also a reflection of your inner health. Taking care of yourself properly, listening to your body, and not ignoring even small changes. These are simple but effective ways to stay healthy and maintain dignity in your old age. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.